Hey, good evening, everybody. My name is Dr. Nathan Thompson with the Wellness Way, Yorkville. It's good to see you guys again. I know it's been several weeks since I've gone live, and I'm going to explain to you why right now. Okay. So, several weeks ago, this was about, I think, 5 weeks ago. I've kind of lost track of time, but I got a lung virus. It actually affected our whole family, and I was just coughing absolutely crazy. And within 3 to 4 days, I just blew through my larynx, and I didn't have a voice for about a good solid 3 weeks. No voice whatsoever. I was just whispering to patients. So I had to cancel a lot of things. I could see people in person. I couldn't see them remotely. Couldn't definitely do a live, or else I'd just be whispering, like really, really, um, uh, just I just wasn't able to do it. So I just had to wait till my voice came back. So my voice came back, started to come back about a week and a half ago, and it's just generally getting better and better and better. So people have asked me, "Hey, what's the protocol to get your voice back?" There is no protocol. Yeah, it's just one of the things I'll tell people is time. I'm going to show that to you in just a second. Is just doing the right things and giving it time for the body to be able to heal. There's no processes that don't take time, especially. So that's a reason for my hiatus. And I appreciate people reaching out to me. I really do. And I appreciate, yes, your thoughts and your prayers. I know people just discount that, but it means a lot to me, especially with my patients. And I've had to overcome a lot of bad jokes from patients, especially a lot of bad jokes that I was just told them. I'm like, you don't think I've heard that before? So this is just yeah, it's been a rough few weeks, but what doesn't kill you makes you stronger, especially. So tonight, what we're going to talk about, guys, is male birth control. And if you are watching right now, you can hear me okay. Just go ahead and let me know. Say hello. Let me know where you're watching from. I'm going to talk about male birth control that's in development right now. I know they're not giving it to people, but it's in development right now so that you can look out on what to look out for of what's coming down the pike. Okay. So, male birth control, one of the biggest things. So, guys, we did do an inflammation talk last week. I did with kind of a scruffy voice. But our next one is going to be Tuesday, August 6th at 6 o'clock p.m. So, if you're from the Chicagoland area, you watch our page, you follow our page, you like our content, and you are having issues with your health, whether that's weight loss resistance, problems with your hormones, thyroid disease, arthritis, type 2 diabetes, autoimmunity, hormone imbalance, whatever it might be, and you're having issues with that, and you need a different perspective, then what I want you to do is get registered for that right now. And I'm going to show you how to register for that in just a second. Um, and so the biggest thing I will tell you guys is the body is designed, it's created to heal. It is a miracle of adaptation. And so if you're doing the same things over and over and you're not getting improvement, then it's time to start looking and start solving problems that haven't been solved yet and start looking at it from a different perspective. So I'm going to show you how to actually get registered. And if you're from the Chicagoland area, this is an in-person event, and make sure that you get registered for it right now. I'm going to show you how to do it, okay? So if you see the link in the top of our page on Instagram, or you see it on YouTube, or you're on Rumble, or you're on Facebook, you'll see a link. It's called Linktree. And if you click on that link, you're going to see a couple of things to register for the inflammation event. You'll see it at the very top. So go ahead and click that link, and then you'll be able to register for that in-person event. I will tell you this, guys, if you're registering for it, we're expecting you to show up. And then also, too, is that, guys, recently I've just like, yeah, I'm not going to be doing any kind of remote consults, at least for the time being. Only because people say, why don't you do remote consults? I'm like, honestly, I don't like them. I don't like talking to people on the phone. I like to see people face to face. And also, if I can see them face to face, I can know pretty doggone certain with certainty that you're BSing me, is whether you're following through with what you need to do. So, but you can find a Wellness Way doctor if you click on that link, and you'll see a link to find a Wellness Way doctor. So just go to that page. That'll take you to the Wellness Way homepage. And if you put in your zip code, it'll locate the nearest doctor to you. That doctor may be able to work with you remotely. Who knows? But go there and try to find a Wellness Way doctor. Make sure that you do that. But then if you're from the Chicagoland area, make sure that you come to that inflammation event. I guarantee you guys, it's going to open your eyes. It's a very, very good event. Okay. All right. Now, the other thing is too is how many of you follow Dr. Patrick Flynn? And if you do, I want to let you guys know, make sure that you watch A Different Perspective, which is a show that he does every Saturday at 8 o'clock a.m. Central Standard Time. And it is streamed live on Facebook. It's on YouTube. It is streamed on multiple different platforms. But Dr. Patrick, who is the founder of the Wellness Way, who guys, he changed my life, my family's life, absolutely changed it. But he puts out so much great content. And in fact, he's talked about over the last couple of weeks, he's talked about plant lectins and inflammation, which a lot of people ask about. He's talked about cellulite, talked about tongue health, what that actually means. Guys, he is just a wealth of information. And guys, that will help you to understand the perspective that we come from when we talk about a lot of things, especially. So make sure that you watch it next week on Saturdays, 8 o'clock a.m. Central Standard Time. Make sure that you watch that as well. Okay. So let's talk about what's in development right now, male birth control. Okay. Now, let me preface by saying this is that I imagine even before I finish up, we're going to get just some angry women that are saying it's not fair that I take birth control and that you're discounting male birth control, because you guarantee it. I'm going to show you perspective that will show that this is not a good idea. So before you say something, make sure that you watch all the way through before you just spout out your ignorant comments. All right. Yes, I will say that. Okay. Because the reason why I say that is because I'm not for birth control, men or women. I believe that female birth control has caused more harm than good. And I also believe if you guys see like the amount of hormone-based cancers that has increased over the last 15, 20 years, I do believe that birth control is playing a part in it, especially. So I'm going to talk about birth control from a different perspective, but I'm not recommending it for men. We don't recommend it for women as well. And if you're like, well, how on earth am I not supposed to get pregnant? Then go back to 8th grade health class. So just remember this is most people, what's amazing is, and even if I said women, if I gave them a sheet of paper and I said, what I want you to do is I want you to write out on a graph how your hormones fluctuate throughout a 28-day cycle, give or take a couple of days. And I would hedge my bets to say that most women can't even draw out when they are seeing, spikes in luteinizing hormone, follicular stimulating hormone, spikes in their testosterone, spikes in their estradiol, their progesterone, to know when is the actual easiest time to get pregnant, especially. And that's why I think in our education system, we've done a really horrible job. Excuse me. We've done a really bad job of teaching people about their hormones, especially. So make sure you go back and you learn that, and make sure you can write it out before you offer an opinion, especially. Okay. So male birth control, what is it? Okay. This comes from about 12 years ago. So this has been in development for a long period of time. The problem is that most men don't want to take any kind of birth control. And there's a very valid reason behind it. So the title of the article is A New Combination of Testosterone and Nesterone Transdermal Gel for Male Hormonal Contraception. Okay. So here's what they did. And it was from a research article, or from a journal called Randomized Controlled Trial. Okay. So they took 99 healthy, and I say healthy because who's saying they're healthy or not? Okay. Male volunteers participated in the study. Okay. Here's what they found. A combination of daily nesterone and testosterone suppressed sperm concentration to 1 million per milliliter. So 1 million sperm per milliliter or less in 88.5% of the men, with minimal adverse effects. I'm like, what do you mean by minimal? And how long were the adverse effects? Is there any long-term issues that are going on? And may be further studied as a male transdermal hormone contraception. What I mean by transdermal is a gel that you put on your skin, and the hormones are absorbed through the skin as well. So this is what they're talking about. So let's talk about this a little bit further. So when I looked at this, I'm like, well, what does Wikipedia actually say about it? And if you type in one of the ingredients called progesterone acetate, here's actually what they say. In healthy young men, I'm like, what do you mean by healthy? Progesterone acetate alone at a dose of 2 to 3 milligrams per day as a transdermal gel for 2 weeks suppressed testosterone levels from 581 nanograms per deciliter down to 276 nanograms per deciliter. Okay. So basically, taking a progesterone, like basically a synthetic progesterone, also known as progestin, basically suppressed testosterone production by 1/2. Okay. Now, I'm going to talk about this in just a second. Testosterone is really suffering in men, and I meet with men all the time. I'm going to show you a clinical example of this, especially. But taking progestin, some progestin is form of birth control. Basically, what it did is that it severely inhibited testosterone production, especially. Okay. All right. So here's the thing. So not only do they have to add progestin to it, which suppresses um, uh, uh, basically spermatogenesis or the man's ability to make sperm, but it also suppresses testosterone, which is actually in regards to sperm production. So what they have to do on top of that is they have to add a transdermal testosterone to it in order to keep a man's testosterone up. So I want you to think about that for a second, okay? So progesterone will suppress the production of sperm, okay? Just like it suppresses the production of an egg. And I want you to think about when a woman is pregnant, she doesn't ovulate anymore. And you have high levels of progesterone at that point will actually inhibit ovulation. That's why when you take certain female birth control, there's high levels of progesterone or progestin that will inhibit ovulation, okay? So progesterone suppresses production of sperm, much like it will suppress the release of an egg, okay? That's why women, they're not ovulating when they're pregnant. The interesting thing is this, it will also inhibit testosterone production, which is why they have to add it to the birth control, okay? So it's inhibiting testosterone production. You can see, I just showed you the clinical example and the research, excuse me, and the research that showed how it dropped testosterone by 50%. So then they actually have to add it to the gel in order to increase a man's testosterone back up. So basically, here's what they want you to do. They want men to shoot blanks, but they also don't want to lower testosterone so much so that they don't have a desire for sex, because testosterone is what causes a desire for sex. If a man has very low testosterone, he's not going to have much desire. So they want a man to shoot blanks, but still have the desire for sex. And the biggest thing I'm going to tell you is this. This sounds like a very, very odd science experiment, doesn't it? It sounds like a very odd science experiment. And that's why it's just, I look at this and I'm like, oh man, we can't be manipulating hormones like this. So here's some questions I have regarding male birth control, okay? Number one, progesterone suppresses the inflammatory response. It does, okay? And the reason why it does is, I want you to think about it. As soon as a woman gets pregnant and the sperm and the egg come together to form a future baby, then one of the things is 50% of the DNA is not the woman's. And so that progesterone suppresses the immune system so that the immune system doesn't start going after something that's not completely hers. So progesterone suppresses the inflammatory response. Now, here's the next question. So why do you think they want pregnant women to get a flu vaccine? And that's because they say that they're more likely to suffer some of the negative consequences of the flu because they're more likely for that virus to actually grow, attach, and cause an infection. That's why they want pregnant women in order to get all these kind of vaccines and things like that. Now, the other question I have is there an immune consequence of being on progesterone to suppress sperm production? So if they're putting a male high amounts of progestin, progesterone acetate is actually what it's called, is there going to be an immune consequence since that does suppress the immune system? And here's the next question. Are they even measuring it? Are they even measuring it? Are they just saying, nah, I think we're good, okay? Now, the reason why I say this is this, because over the past couple of years, there's just been this explosion of people trying to lose weight and using GLP-1 agonists. I've done a lot of videos regarding that, so I don't need to go back and do this. But GLP-1 agonists, one of the biggest things that they do is they make you fuller longer, and they delay stomach emptying so that you feel fuller so that you eat less, okay? And so, but people have been doing this and have very, very strong opinions. I have a strong opinion regarding that too. But here's what's interesting is I saw come across as a new study that comes out of the Journal of American Medical Association. And here's the title: Risk of Non-Arteritic Anterior Ischemic Optic Neuropathy in Patients Prescribed Semaglutide, which is Wegovy, Mounjaro, all of these GLP-1 agonists that people are using for diabetes, kind of, but now they're trying to use it for weight loss and things like that. And now what they're seeing is that, wow, we're seeing that some people are going blind from doing that, and it's damaging their optic nerve. And you know what they say? We need to take this off the market and stop abusing it. Rather than say that, you know what they say instead? We just need more studies. Guys, one of the things I will tell you is before any drug gets pulled off the market, it was first deemed safe and effective. Makes you kind of wonder in regards to that, okay? So if you go to Open Evidence AI, which is an AI platform that looks at all of the research that's out there and just kind of conglomerates it, yeah, artificial intelligence. So here is actually what they say. And I'm going to show you how they're just looking at the research. They're not giving you any kind of opinion whatsoever. OpenAI talks about birth control. The safety and efficacy of male birth control gel, specifically a transdermal gel, meaning it's spread on the skin, containing testosterone and progesterone acetate, also known as nesterone, are currently under investigation. A large international multi-center open label study is being conducted to evaluate the contraceptive efficacy and safety of this self-administered daily gel. Now, previous studies have shown that male hormonal contraceptives, including those using testosterone and progestin combinations, which is what it is, can effectively suppress spermatogenesis or the production of sperm and are generally well tolerated in the short term. Okay. However, long-term safety data are limited, and potential adverse effects such as acne, weight gain, and mood changes have been reported, like when you do take any kind of TRT and things like that. Now, here's what they continue to say. A randomized controlled trial assessing the acceptability. So they had a randomized controlled trial, meaning do people accept it, as if that is any kind of indication that people should be using it as well, of a transdermal gel-based male hormone contraceptive regimen, found that a majority of participants were satisfied with the method. So they say, well, it's efficacious because people actually accept it. Here's what I have to say about this. You go to the actual article, and this is actually where they're reporting this from. And this is randomized controlled trial. And this is fairly recent. Acceptability of a transdermal gel-based male hormone contraceptive in a randomized controlled trial. It wasn't, is it safe? Is it effective? The randomized controlled trial was all about, hey, do people accept it? Okay. Here's what they found. Overall, when they say a majority, you're thinking 80, 90, 95%. Overall, 56% out of about 80 men were satisfied or extremely satisfied with the gel-based method of contraception. And 51%, or barely a majority, reported that they would recommend this method to others. Okay. Now, a majority of the men who volunteered to participate in this trial of an experimental male hormone contraceptive were satisfied with this transdermal male hormone contraceptive. And if commercially available, combination of topical nesterone and testosterone gel could provide a reversible, effective method of contraception that is appealing to men. Okay. So they're just saying, well, we got to use it because men like it. Okay. But let me ask you a question. Is it acceptable just because people like it? And I'm going to give you a perfect example. Let's say I have a lot of knee pain. Okay. And in fact, when I was an athlete growing up in high school, I had a lot of chronic pain. Most people have never heard my story of how I had so many chronic illnesses, so much chronic pain, things like that, a lot of joint pain. And I would take about 6 Advil just to be able to get through practice. And guess what? It took away my pain, or it made me pretty functional, but that doesn't mean it was acceptable. And I liked it, the fact of what it did. So let's talk about chronic NSAID use, non-steroidal anti-inflammatory drugs, Tylenol, Aleve, aspirin, all these things that people take for pain. And now, if you're watching the slides, you're going to see NBA Hall of Famer Alonzo Mourning, who needed a kidney transplant because he had kidney disease. But if you look and Alonzo Mourning's history, he talks a lot about having a lot of chronic pain and taking a lot of Advil in order to help with that pain. And it crushed his kidneys, crushed him so much that he needed a kidney transplant. So let me ask you a question. Is it acceptable? Is chronic NSAID use acceptable just because it decreases pain? And you have to ask the question, well, how does it affect the gastrointestinal system? How does it affect the kidneys? Sorry, let me clear my throat. Drink of water as well. So what about the kidneys? There's side effects with all of those different things. And so I don't even want to call them side effects because they're effects. If you do them, there's going to be effects. That's why people talk about side effects of medication. They're not side effects, they're effects. And they don't like them. So they call them side effects or one offs or things like that. Okay. So this comes from the Lancet Diabetes and Endocrinology. And here's what they said about male hormonal contraception: hope and promise. Okay. Male hormone contraception is highly effective and with perfect use failure rates of 0.6%. What that means is if you use it perfectly, 0.6 people are going to get percent of people are going to get pregnant if sperm concentrations are less than 1 million per milliliter if they're maintained. Short-term adverse events are acne, night sweats, increased weight, and altered mood and libido. Altered mood and libido are recognized, but they're just kind of generally mild. Okay. Now, here's what's really interesting, because if you've taken female birth control, have you ever noticed a change in your mood because it's manipulating, it is considered an endocrine disruptor and it's changing your hormones. Okay. Here's an interesting article that I brought up from about 5 years ago. And this is why it's very important, whether you're on female hormone birth control or male hormone birth control. It's this. The title of it is High Progesterone Levels Are Associated with Family History of Premature Coronary Artery Disease in Young, Healthy Adult Men. Okay. The conclusion they found was progesterone and luteinizing hormone levels are significantly associated with family history of premature coronary artery disease, independent of traditional risk factors for coronary artery disease. So what are they saying? Well, what does the doctor say is a risk factor for coronary artery disease? High cholesterol, plaquing, and things like that. And so what they found is that men generally with high levels of progesterone, i.e. like they're taking birth control in order to suppress their testosterone and also sperm production, is that they take this and that high amounts of progesterone are associated with premature coronary artery disease. So it kind of makes you wonder. So biggest thing that I'm going to tell you guys is you can't outsmart your body. You can't outsmart your body. Your body is infinitely smart and it's always adapting to all those things that you are doing. And you have to look at hormones as responders to inflammatory stressors. And this is why when you say, what's the protocol for balancing your hormones? Well, take your bucket, remove as many inflammatory stressors as possible. And a natural progression of the body is to start to be able to recover and be able to heal, as long as there's not things that are interfering with it as well. Now, let me give you a perfect example, because I think I skipped over it, but I want to go back and I want to read this from a patient. Hopefully, I think it's on here. Yes. Okay. So this right here it's actually a review. She gave a great testimony. Her name is Jackie. Wonderful, wonderful woman. You can go and read that review if you go to Exemplify Health Center or the Wellness Way Yorkville, and you can find it as a Google review. You'll also find some other interesting reviews from some people who obviously have mental illness. I don't know. I don't know what else that might be. I don't even know them personally, but you can just tell there's something a little off with some of these people who leave very bizarre and weird reviews. So let me read what she had put, because it brought a tear to my eye. This is why I do what I do. She said this: I've been in Dr. Thompson's care for 15 months. And you might say, wow, that sounds like a long time. Not when you're chronically sick, when you're chronically ill. When I started, I had double cancer diagnosis that was somewhat resolved, but I was looking at a third type of cancer diagnosis. I was in tremendous pain. She was. And I was taking high doses of pain medication, which I know she was as well. I was in a lot of pain, especially when I ate. I was frequently dizzy. I had brain fog and I couldn't remember things, and the fatigue was just constant. I was unable to drive or work and couldn't enjoy the things I love to do, like horseback riding. And by the way, she's back to horseback riding as well. I spent most of my time in pain and in bed or on the couch. Medical doctors couldn't give me any kind of answers or any kind of treatment. Dr. Nate started with testing, which we always do is with testing, then gave a plan based off my history and the test results to help restore health, not to treat health. Doctors treat, but we're there to health restoration. Okay. Today, I'm off of all pain medications. She is, and many other medications. And I've also been able to decrease thyroid medication. And here's what's wonderful: I can drive again, even long distance. My memory is almost back to normal, and I'm able to enjoy horseback riding regularly again. I climbed over horse fencing last week, something I haven't done in almost 2 years since my diagnosis. I can carry water buckets for horses. I work out regularly with a trainer. I'm rarely, if ever, laying on the couch anymore. I'm thankful to Jesus for healing me and bringing me to Dr. Nate. And we are very thankful for her too. I always say that God designed the body miraculous, and you got to do it according to his plan. You can't be breaking the rules, especially. But you know who I'm also thankful for that she didn't mention? The woman who referred her in. Because without that, she told me, she sat here last week while I was getting my voice back. She sat in a consultation room. She said this: Dr. Nate, if I'd never met you, I would be dead by now. That's some pretty sobering words. And that leaves a lot of weight on my heart to make sure that people follow through and that they're doing a great job as far as working on getting healing. But I love reviews like that. You may ask, what was the protocol? There was no protocol. There's no protocol. You know what the protocol that works is based on you, based on your testing and what needs to happen. Okay. Guys, quit trying to follow a protocol. I mean, my goodness, everybody's out there on Instagram, on Facebook. You see them as ads. Here's my protocol. And we're all looking for a protocol. And you know why? You know why they're crazy? Because they don't require any kind of thought. So there is no protocol. Please don't ask me. That's why people said, how'd you get your voice back? What was the protocol? As if I need just a list of things to just blindly follow. And we need to stop doing that as well. Okay. So I talked about, you can't outsmart the body, guys. If you look at hormones are responders, and they're messengers and they're signalers. And one way to actually decrease them is to carry a lot of stress, carry a lot of inflammatory roadblocks, and the body starts to respond accordingly to it. Okay. Now, here's the problem that I see with just wanting to the problem that I see with taking any kind of TRT and things like that is that it's got to be metabolized in the liver, and it's got to be converted in the liver into estradiol. Okay. And this is why TRT can produce a lot of stress on the liver, because the liver is just starting to become overworked. Okay. So I want to give you an example, of a gentleman who just came in. He was just at his wit's end. He was just gaining tons of weight. And about a couple of years before, his doctor had put him on testosterone replacement therapy. Okay. And so the testosterone replacement therapy, after being on it, initially felt good, but then it started to swell his liver. So his liver started to get swollen. He started to develop breasts. Goes back to his doctor, and they're like, well, we can just put you on estrogen blockers, aromatase inhibitors, but it still just made him feel lousy. He started gaining tons of weight and things like that. So by the time he came in, he had actually gone off of his TRT, which, if you look at his tests off of TRT, his initial testosterone was at 66, which is basically at a level of a woman, like a high amount of testosterone for a woman. It was just so ridiculously low. But if you look at this, terribly low vitamin D. You can also see high inflammatory markers with homocysteine. And then you also see he was pre-diabetic. Now, not only was he just felt awful, and he was having a lot of issues with weight gain, just terrible fatigue, poor energy, but also started to develop a lot of skin discoloration. So I'm like, okay, do a stool test, see what's happening around that immune system barrier. And you can see that that very high inflammatory levels were going on. You can see pathogenic bacteria. He was developing infection within his gastrointestinal system. So you see just a lot of things that are going on. And here's the cool thing. He's recovering. He's getting better, but it's going to take him a long time for that body to be able to recover. And that's why I always say, you can't give up. You can't give up. I don't ever give up. I don't give up on people. I don't give up on anything, which is, people say, they always tell me you should just give up. I'm like, I'm never going to give up. It's not in my vocabulary, but people always give up. And that's why when people say, who are the worst people in the world? People who are quitters. So I still love them. I still care about them. But people who quit all the time, this is why I say, put someone through a really tough workout, and I'll explain everything about their life when I watch them during a 5-minute workout. I'll explain everything of what's going wrong in their life, especially. So this guy was absolutely wrecked by taking synthetic hormones, and he'll tell you that, and you'll see all of the issues that took place as a result. He just basically became a weird science experiment as well. Okay. Now, whenever they say healthy males, yeah, we gave birth control in healthy males. I'm always saying, who defines a healthy male? Okay. This is why I ask people, what is health? And no one to this date has actually gotten it right. And in fact, most doctors don't even know what health is. Health is when your body is functioning and healing at 100%. So who's defining healthy males? Because if you look at a study they did about 4 years ago, we are seeing testosterone levels show a steady decrease among young US men. Now, yes, we are seeing it just go absolutely, south in men in their 40s, in men in their 50s and things like that. And I work with people all the time, especially men that are having declining testosterone levels. And we're not recommending a bunch of supplements and stuff. We fix their lifestyle and we remeasure it afterwards. But even if you look at young US men, you have seen a historic steady decline of testosterone at this point. And where should a young man's testosterone be? Well, I just showed you that research study was at 550, which is not very high for a young man. Their testosterone should easily be 700 to 800. But what happens is we just absolutely destroy it, and our body starts to respond accordingly as well. And that's why I have such pause and such great hesitation when men are already having problems with progesterone to then start manipulating it with hormones, even if it's short term, in order to try to lower their sperm production and lower their testosterone counts with some kind of synthetic progesterone, and then try to get it back up with testosterone after that. And we don't think it's not going to cause any kind of burden on our body and on our liver and things like that. So here's the biggest thing I'm going to tell you guys is there is a God. I'm not him. There is a God and I'm not him. And I just see how many doctors, rather than sit down and try to help a person with their lifestyle, what they do instead is they just want to throw them a medication and a drug to try to manipulate them. And the consequences can be devastating long-term. Okay. So that's why we don't want to try to manipulate things, but we want to honor it by doing the right things. And that's why we always talk about the Swiss watch principle, that everything affects everything. And if you want to try to manipulate your endocrine system, there's going to be a consequence to every single system inside the body. You may not feel it right away, but you will over time. That's why I always will say, and we talk a lot about this at the inflammation talk, is why, like when you see someone and they have a lot of skin issues and we're saying, get a stool test done or check your foods. The reason why you'd be amazed at how many people's skin starts to clear up when you start addressing that. And so many times what we want to do is we want to address where the organ is screaming, and that might not be the biggest issue. And that's why I say this. Hey, did you know your big toe controls your heart? And you may laugh, but take your shoe off, give me a hammer, and I'll just keep smashing your big toe as much as possible. Let's take your blood pressure and let's see what happens. What's the result of doing that? So the body works together like a Swiss watch, but what do? We keep going to specialist to specialist to specialist. And you know what? A specialist is just someone who knows more and more about less and less until finally they just become experts pretty much in nothing. So guys, our next inflammation event is Tuesday, August 6th at 6:00 p.m. This is an in-person event at the Wellness Way Yorkville here in Yorkville, Illinois. So if you're from the Chicagoland area, please go to the top, go to the Linktree page, and you will find a place to be able to register for it. I have it actually spelled out. Right here is where you're going to register for it. You can also find a Wellness Way doctor if you're out of the Chicagoland area. So just go to that, and then you'll type in your zip code and find someone who's closest to you as well. You may be able to even find one that will work with you remotely as well. But I will say this. Don't show up unless you're really willing to change your life. Don't show up unless you're willing to change your life. Guys, you're not just one herb away from ultimate health, okay? You're not just a reishi mushroom away from ultimate health. You're not an albizia away. As long as I take a teaspoon every day, I'm going to be fine. No, you're not. You need your health restored. You don't need a bunch of supplements. Guess what? If you need a bunch of supplements to feel normal, then you're still sick. So make sure you go to that page to get registered for that. Please make sure that you do that. I would love to see you at that inflammation event, and I'm always honored when people take time out of their busy schedules to come and hear me speak. So male birth control, what are your thoughts? It's a weird science experiment. And that when you see it come down the pike or you see your doctor recommending it, Now you'll have the knowledge, because with knowledge becomes wisdom to be able to know how to navigate some of these things as well. Okay. So, guys, if you like this, make sure you like our page, make sure you follow, make sure you get registered for the Inflammation Talk if you're from the Chicagoland area. My voice pretty much held through for the most part, maybe with some coughs, things like that. I guarantee it'll be better next week. I don't have a topic. Maybe we'll do a question and answer at that point. So, guys, I love you. Appreciate all of you. I hope you guys have an awesome, wonderful rest of your week. Be well, be blessed. As I always say, make sure you always remember who you are. So we'll see you.